Hi everybody, my name is Sudine and I've travelled all the way from Australia to be here. So I'm going to show you some, why is it moving? Do you want this one? Do you want this Anyway, just before, while we get this fixed, I work at the University of Technology in Sydney in the Faculty of Health, and for the last 20 years I've taught communication across a whole range of health disciplines. So I teach medical students, pre-med, health science students, Chinese medical, or students who are doing a Chinese medical degree, and also nurses. And my particular area of interest and research is in empathy and compassion, in developing learning strategies, teaching strategies for students and graduates to develop their empathy and compassion. So this is Sydney, anyway, where I'm from. And the reason I'm here, I was really excited last year to meet Carrie Hamilton, who visited our university, spent some time talking to people in the faculty, and when she mentioned this conference, I thought, wow, it sounds fabulous, and also a great opportunity to visit Belfast, and I'm really enjoying the conference. It's fantastic. So there's our lovely Sydney Harbour and the Opera House. Okay. So the questions that people often ask about empathy: are nurses naturally empathic? Isn't empathy inherent? You either have it or you don't. Is empathy something that can be taught? And is empathy critical for nurses? Well, I don't think there's any doubt that any of you will have that it's absolutely critical for nurses and healthcare professionals. It is something that can be developed, and there's lots of literature around it with evidence to support that it can be developed. I think nurses, in the past, I think a lot of nurses were drawn to the caring professions because they were empathic. I'm not sure that that's the case now. So that's one of the reasons why I'm really interested in the area. So why is empathy essential for healthcare professionals? Well, there are many reasons why, and we know from here that 52% of patient satisfaction with healthcare is higher when clinicians demonstrate empathy. 93% of patients believe that a lack of empathy actually lowers the quality of care. Less than 1% of patients describe their interactions with healthcare professionals as empathic encounters, and I think that's such a concern for us as healthcare workers to know that that's what our patients are saying about us. 50% of post-operative morphine requirements are reduced following an empathic interaction with a healthcare provider. In the general community, empathy levels have declined by more than 40% over the last 30 years, so there's something really happening here, I think. And Barack Obama actually was quoted as saying that there's, stop worrying about the economic and fiscal deficit in our communities. He said we need to worry about the empathy deficit. So that's a quote that he came up with that's quoted quite a lot. 25% of cellular immunity of patients with lung cancer. It's 25% higher when cared for by oncology nurses with high levels of empathy. 20% conveying empathy in healthcare consultations reduces pain, depression and anxiety by more than 20%. So the evidence is really clear. I think that there are many, many benefits to interacting with our patients in an empathic way. Just some other quick figures here. 42% empathic interactions with doctors improve diabetic patients' glucose control and result in 42% fewer emergency department visits. 62% patient adherence to treatment regimes is higher when healthcare professionals have undertaken empathy training, and 50% empathy levels can decline by up to 50% during the period of enrolment in an undergraduate nursing or medical degree. And that's something that really interests me, because a lot of the evidence shows that whilst healthcare students might start out with a high level of empathy, it actually declines for the duration of their programs, and particularly after their interaction in the clinical area with patients, which is even more of a concern. So we don't know what's going on there, but we need to do something about it. And I think, of course, I don't think there's any doubt that the technological advances and the obsession that people have with technology is absolutely, not helping the interaction and the communication and the connection we make with people. I'm going to hurry through these slides because I want to talk about the Virtual Empathy Museum, which is really the purpose of this presentation. I'm very happy to give my slides to anybody upon request if you're interested in some of this content. These are just slides about trying to encourage or develop in students an ability to identify non-verbal communication, because it's difficult to accurately detect what people are trying to demonstrate by their non-verbal communication. So why is empathy, oh no, I've done that one, so where am I going? Okay, so why do healthcare students' empathy levels decline? I think I've mentioned that. Other reasons are that the curricula in many healthcare professionals prioritise technical skills and knowledge over humanistic values such as empathy. And in my experience teaching in a university for over 20 years, the emphasis on communication has certainly decreased over the last 20 years. Much more emphasis on technical skills and the communication input into the curriculum. People say, oh, we integrate it into every other subject. Well, my feeling is that when it's integrated, it just gets lost. And if we don't role model it to our students, as saying, well, we've got subjects and an emphasis on communication, how can we expect students to appreciate the value? Limited attention to the teaching and assessment of empathy skills, desensitisation and compassion fatigue resulting from exposure to human suffering without adequate education, preparation and support. And I think that's one of the reasons why we need to concentrate on developing empathic and compassionate behaviours in our students, because the evidence clearly shows that when healthcare professionals engage in more compassionate behaviours, stress and burnout are actually reduced. Poor role models and negative health outcomes are also important. The relationship between empathy and attitudes to vulnerable and stigmatised groups is a particular concern, and the evidence again shows us that we're more likely to be empathic to people who look like us, same socio-economic group, same demographic group, than people who aren't. So people from culturally and linguistically diverse backgrounds, and particularly refugees and people seeking asylum, have reported lack of empathy in their interactions with healthcare professionals, people with a physical or intellectual disability, people experiencing mental illness, socio-economically disadvantaged groups, especially the homeless, and people with lifestyle-related illnesses and older people. In Australia at the moment, there's a Royal Commission underway into the aged care services, and it's appalling how the media are reporting the cruelty and the terrible situation for older people in aged care services. So national and international healthcare reports tell stories of appalling suffering, and we know that, and you'll be familiar with the Francis report here, of course, which is highlighted all around the world, I think. But empathy is starting to get a little bit more prominence. People are researching and writing about it and talking about it, which can't be a bad thing. Can it be taught? Well, yes, it can be taught. Systematic review of the effectiveness of empathy education for undergraduate nursing. These are some of the systematic reviews. A total of 80 studies that we found in a systematic review, with 73% demonstrating a significant change in empathy pre and post empathy interventions. I'm going to skip through the empathy continuum, but I'm happy to give my slides to anybody who would like them. And of course, when we're thinking about are we inherently or naturally empathic, we can think of children and babies. We notice that when babies are sitting opposite another baby who's crying, the baby will be empathic and cry in sympathy or empathy with the other child. So it's definitely something that is inherent in us, but we often need to develop it. So that's the continuing. I'm not going to talk about. I'm going to talk now about this virtual empathy museum. which we got a team of people in my faculty. We got a research grant to develop this virtual empathy museum. And I'm just going to run you quickly through some of the features of this museum. And it's available online for everybody to use. It's a fantastic resource, I'm sure you'll agree. I know what I've done now. So you can Google it, it's available on the internet. When you get into the Empathy Museum, these are all the different rooms that you click on. You can click on, and I was hoping that I could sort of click on and show you. But we have a film room, where people can access resources about film. So all of these resources are useful for your teaching if you're trying to teach empathy. So there's a film room, a reading room, a meditation room, an art room, a resource room, a digital storytelling room, and a simulation room. So in all of these little spaces in the museum, when you get onto them, for example, in the film room, you'll read reviews of films with questions and discussion starters for students. So it's a really terrific resource, and just show you. So when you click on it, you'll find in the simulation room there are some terrific resources. One of them is a hearing voices simulation that we use in our teaching in our nursing course. It takes you through some, if you click onto the resource, you can play on an MP3 player, voices of people who hear voices here. And then we we direct the student or whoever's using that particular resource to try to leave the headphones on and go and try and conduct a conversation with somebody while the voices are playing, or read an article and answer some comprehension questions. So there are some fantastic resources. So has nobody's accessed it yet? Have you accessed them? Yeah, oh, you have? Oh, terrific. Yes. Yeah, so it's, and do you think it's a good resource? I'll probably run out of time. Yeah. So please access the resource. I'm really sorry I couldn't open it and show you more, but you can access it and have a play with it because the resources are fantastic for teaching. Thank you.